Hi, my name is Olivia Pennington, and today I'm going to be talking about how my BSN degree has prepared me to become a nurse and everything that it has taught me and everything that I want to include in my nursing career and everything that I believe will make me a better nurse. So first I'm going to start off with the liberal arts curriculum and 3 principles that really stood out to me. The first principle was to value the idea of lifelong learning to support excellence in nursing practice. So to me, this means that I'm going to embrace all of the education that my unit gives me and just truly learn from it and take away everything and not just get it done to get it done and rush through it, but truly take the time to learn and see what I can take away and take into my nursing practice. And then second, I'm going to start to research my patient's diagnosis. So I work on an ortho floor, and sometimes these kids are total care. And so I'm just really going to try and get a great background and a full history on my patients and just truly understand what they're going through so I can know kind of what's baseline for them and where to go from there with my care plan. And lastly, I'm going to look for advice from more experienced nurses. I have learned that it is okay to ask for help and that it is never a bad thing. And as a new nurse, that can be kind of intimidating. The second principle I'm going to talk about is using written, verbal, nonverbal, and any technology to communicate effectively. So the first thing that came to mind to me with this was the PEWS. So PEWS is Pediatric Early Warning Score. And so we use this with our kiddos just to see where they're kind of at in their care and if they're declining or if they're improving. And this just kind of helps us to know when we need to be communicating with the physician and when they need to come up to the floor and assess the patient. So it's really helpful. And then we also use these things called text pages, so it's really nice. We can send a little message in it and kind of let them know. We just have to be really careful about PHI. And so that's really been helpful with communicating. And then I've also had to knock on residents' doors at night because I had a patient that was on their way to the PICU, so the pediatric ICU, and we couldn't get a hold of anybody. And so we just needed them to get the ball rolling and make sure that our patient was okay and was receiving the best care. Lastly, I'm going to apply the last principles. I'm going to apply the knowledge of social and cultural factors to the care of diverse populations. So at Children's, we do have a lot of different cultures and backgrounds. With being the only children's hospital in a certain amount of miles, I'm not sure what the exact distance is, but we see a lot of different populations and care for a lot of different populations, which is honestly incredible. So to do this and to better my care for those diverse populations, first I'm going to learn how, like anything that I might need to educate the family on and just kind of learn what they need to be educated on. I'm also, first and foremost, going to research their culture and just kind of get a feel for how they like to be talked to, how they like to be approached, the most effective way to communicate with them. And I'm also going to learn and ask them if they have any certain prayer times or any meal restrictions, because I just want to be respectful of their culture. And as with any patient, we always want to make sure that they're comfortable in the hospital and that they can go on with life as normal as possible within the hospital room. And I know that can be difficult, but that's really a goal of mine, is to always make sure that my patients are comfortable with me and that they just feel okay to tell me, hey, we have prayer time right now. Can you please go and come back and check on the patient? If the patient's stable, then of course I will. But if the patient's not stable, then we always explain. So next I'm going to talk about how I plan to continue my education. And so the first thing that I am so eager to start, which I've set a goal to start after my first year of nursing, is to get my CPN. So CPN is Certified Pediatric Nurse, and this just really focuses on the overall assessment of kiddos, so the physical assessment, psychosocial, and then also really emphasizes on growth and development and like health promotion overall. So we focus on growth and development, so kiddos going through puberty. We like to promote infant bonding as well, and then safety things. So with our infants, we want to do back to sleep, and then safe car seat information. Toddlers with nutrition, so introducing solids, explaining how you have to introduce one solid at a time to assess for allergies and all of that. And then preventative care. So obviously vaccines is a huge thing right now, huge controversial topic. And a lot of families, we have had families come in that aren't vaccinated. And so we always go in there and educate them, and just we have to be really we have to be well informed on those so that we're able to teach our patients and hopefully get their children vaccinated. And we also learn more about the psychosocial needs, so bullying and social media. We do see a lot of suicidal ideation patients, which is heartbreaking in pediatrics as it is at any stage of life, but it's sad to see young kiddos coming in with that mindset. And then also life choices. So we talk to our teens about drugs and safe sex, and just CPN just helps you feel more comfortable just taking care of pediatric patients at any stage of life, and it just really makes you more confident and more aware of things. And then secondly, I plan on expanding my education, which I kind of talked about this, is like unit curriculum. I'm not going to just take my unit curriculum and rush through it and take the test over and over again just to get it right and get 100% and move on. I'm going to really try my best to engage in education and take away everything possible so that I can provide the best care for my patients. And so if this means that I need to research more and complete the modules, take more time to complete the modules, then I'm going to do that, because honestly with pediatric patients, and usually patients overall, their status can change really quickly, and it's just important to really know your information and have a solid education standpoint and just kind of know your patients. And so next I'm going to talk about how I'm going to be a servant leader in my role as a nurse. And so with my patients, I want to have great foresight. And so I want to constantly be aware of my patients' status, if they're declining, if they're getting better, potential things that could happen. So example, like a patient being in the hospital for a long period of time, I need to be monitoring for infections, and just really being a servant leader in the aspect of foreseeing certain circumstances that could happen. And then with my patients' families and my patients overall, I am going to be a servant leader by being empathetic and listening. This is huge in healthcare overall. Oftentimes patients and their families just don't feel heard. And so I just really want to make sure that I know what their expectations are, what our expectations are, and that they are on the same page as us, and that we are listening to them, that they feel like we're listening to them. And then in my personal life, I just really want people to know that I am a good listener and that I'm empathetic, and that my door is open 24/7, and that they can always come over to talk to me or vent. And if they want me to give advice, I'll give advice. If they just want to cry on my shoulder, I'll let them cry on their shoulder. And then in regards to my peers and coworkers, to be a servant leader with my peers and coworkers, I feel like I need to hold them accountable, and I want them to hold me accountable. And so what I mean by this is that as a servant leader, you're constantly supposed to be growing and challenging yourself. And so as a new nurse, I've learned that, once again, it's always okay to ask for help. Like, never not ask for help, because we are dealing with patients' lives. And so I'm learning my strengths and my weaknesses, and where I can help my peers and coworkers out. Like, I'm more than willing to help them out, and then I'm not afraid to ask for that help in return. And so just kind of keeping each other accountable so that we can grow and better ourselves as nurses. And then lastly, holistic care. So my view of holistic care throughout the BSN program has completely changed. Even from the start of nursing school, I was terrified about the word holistic, and the holistic care was just scary because it seems intimidating at first, because there's so many boundaries in the healthcare field that you can overstep. Personal touch, hugging parents, or talking about religion. And so I always make it a point to really get to know my patients when I either admit them, or when I come on shift and I've never had them before. I just really try and get to know them, and kind of look at their history a little bit. And I always ask, like, if they have any chaplain needs, social work needs, or child life needs, and just kind of get a feel for that. And I also just, providing holistic care obviously means more than taking care of the patient. You have to take care of the family too. And in pediatrics, that's huge. You have to look over and kind of see how the patient's parents and their families or guardians are handling certain situations. And after everything's okay with the kiddo, if they're unstable for a little bit, I always go and sit over there with the family and talk to them and kind of debrief with them, because I feel like that is crucial. And what I've learned about this is that if you provide holistic care, your families are more grateful, your patients are more grateful, you establish more trusting relationships, and you typically have better outcomes. And so these are all the ways that I'm going to incorporate my BSN education into my nursing career. Thank you.